questions throughout the presentation in the chat. Our colleague will be answering those along the way, and then also feeding questions to me to address at the end during the Q&A period. We would also ask that during the presentation, you shut off your video just to ensure that we don't encounter any bandwidth issues for anyone on the line. And welcome, and thank you for joining us. We're so excited that there's so much interest in this call, and that folks are keen to submit some really strong proposals. So thanks again for joining us today. I will introduce our Grand Challenges Canada team that is on the line today. So we have Swad Ali, who is the program coordinator, program analyst on the Stars and Global Health team. And Swad will be monitoring the chat, answering any, light lift questions. And then the more in-depth questions she'll be feeding up to me to be addressed at the end of our session during the open Q&A period. We also have Laurie-Sarah Gauthier, who is joining us as the administrative coordinator for the Stars and Global Health program. She'll be our tech guide for the day. So if you have any issues, feel free to shoot her a message through the chat. And then we're also joined by our senior communications associate, Megan Foreman, who will be also just joining us for today's session. And my name is Dominique LaForest. I am the program officer leading the Stars in Global Health program here at Grand Challenges Canada. And once again, we're thrilled for you all to be joining us. So let's get moving. Today's agenda, we're going to start with an overview of the Stars in Global Health program. Then we're going to cover the RFP focus areas and anticipated outcomes. We'll then touch on key funding details and deadlines. We'll discuss project eligibility and then go through an overview of the screening and review process. We'll then share a few application tips and tricks, and then move right into the open Q&A period. We're going to hold quite some time at the end for that purpose. So we'll, as I mentioned earlier, we'll address any questions that have come up and have been unanswered in the chat, and then allow folks to answer any questions live as well. So let's get right into it. The problem that Stars in Global Health is working to address. Ensuring good health and well-being is essential to sustainable development, yet intolerable inequities in health between high and low-income areas in the world persist. Innovation is crucial to the achievement of the Sustainable Development Goals, yet promising innovations are often limited in their ability to achieve scale and sustainability. The goal of Grand Challenges Canada's Stars in Global Health program is to solve complex health challenges by supporting bold ideas with the potential for big impact, resulting in improved health and well-being for people and communities in low and middle income countries. The Stars in Global Health program is Grand Challenges Canada's flagship portfolio to test the potential of new pipeline in areas of strategic interest for Grand Challenges Canada and our funders. The platform serves as an opportunity to test new strategies in order to improve the inclusivity and representation of innovations across the organization. It is also a flexible and responsive platform that allows adaptability at each round of funding to meet the most salient development needs. The STARS program provides funding to explore transformative ideas at proof of concept that apply integrated innovation in order to sustainably bring solutions to scale. Grand Challenges Canada supports innovators as they iterate on their ideas and develop strategic partnerships that can improve the sustainability and achieve meaningful impact. Since 2010, the Stars in Global Health portfolio has supported 752 innovations implemented in 86 low and middle income countries by institutions across 71 countries with over $78 million over 10 rounds of funding. Of the projects funded through the program, 68% have been led by innovators from low and middle income countries, with 39% of the portfolio led by women innovators. In the last 3 rounds of funding specifically, this statistic has increased with 47% of projects being led by women. To date, the Stars in Global Health program has generated significant results, as can be seen on the slide in front of you. Since 2019, the program has focused on sexual and reproductive health and rights. Sexual and reproductive health and rights are fundamental to gender equality and the empowerment of women, adolescents, children, and LGBTQI+ people. Although substantive progress has been made in addressing certain components of sexual and reproductive health and rights, these advances have been inequitable across and within countries. Moreover, in many settings, people continue to have insufficient access to sexual and reproductive health and rights services for neglected but essential issues such as adolescent sexuality and reproductive needs, sexual and gender-based violence, and child early and forced marriage. These are all contributing factors that limit the ability of women, adolescents, and children and LGBTQI+ people to realize their human rights and rights to health. The COVID-19 pandemic has exacerbated the challenges in improving the sexual and reproductive health and rights of women, adolescents, children, and LGBTQI+ people. Due to the associated economic and social impacts of the pandemic, these populations face significant barriers to access key sexual and reproductive health and rights education and services, reversing years of progress. The deprioritization of sexual and reproductive health and rights education and services during the pandemic is anticipated to have detrimental effects on this progress. Despite the World Health Organization's interim guidance shared in June of 2020, including reproductive health services as essential services to be maintained during the pandemic, many countries are struggling to balance the need to respond directly to COVID-19 while maintaining essential service delivery. With many countries instituting lockdowns, access to and demand for modern contraceptives and other sexual and reproductive health services, particularly for adolescents, have been greatly affected. To address these persistent challenges, in this 11th round of funding, the STARS in Global Health program is seeking bold ideas that will improve the sexual and reproductive health and rights of women, adolescents, and children, and LGBTQI+ people in Sub-Saharan Africa. The bold ideas are expected to improve the access, use, and quality of comprehensive sexual and reproductive health education and services, and to be resilient to pandemic control measures like those introduced to control COVID-19. Of particular interest to Grand Challenges Canada are innovations that improve responses to sexual and gender-based violence. Proposed innovations must be bold, innovative, and designed with and for people who are not adequately served by current approaches to sexual and reproductive health and rights. All innovations must demonstrate a rights-based approach, the principle of do no harm, and must be gender-affirming or sensitive and inclusive to the extent possible. Proposed innovations must have the potential to be sustainable at scale, and all proposals must demonstrate their relevance in the context of the current and potential pandemic responses. Ultimately, Grand Challenges Canada is looking for innovations that seek to improve the access and demand for quality sexual and reproductive health and rights information, supply, and services that lead to at least one of the following priority outcomes. First, increased met need for comprehensive contraception care and education, a decreased rates of sexual and gender-based violence, decrease in the impact of sexual and gender-based violence, decrease in the incidence of female genital mutilation, decrease in the incidence of child and early forced marriage. We encourage proposals for innovations in all forms: technologies, products, services, processes, business models, policy approaches, and/or delivery mechanisms. So now that we've covered the who, what, and why, let's get into some details. Successful proposals will be awarded seed grants of up to 100,000 Canadian dollars for up to 12 months to develop and test the proposed innovation. Assuming a sufficient number of proposals of merit are received, we aim to award approximately 60 to 70 seed grants in this round of funding. Proposed innovations must be implemented or tested in Sub-Saharan Africa during the project period. A complete list of eligible countries can be found in Appendix A of the RFP document. If you have not yet reviewed this document, we strongly encourage you do so. Appendix A should provide quite a bit of clarity on who can apply and where they can implement. In terms of target users, while we greatly encourage the involvement of men and boys, the intended target users of proposed innovations must be underserved populations, including women, adolescents, children, and LGBTQI+ people in low and middle income countries in Sub-Saharan Africa. I should clarify, because we had some questions about this in the last session, that a project does not need to address all of those groups. If you address any of the groups within that set, you're eligible. So hopefully that adds some clarification. Now, before moving to the review process, all applications will be screened for eligibility based on the below criteria. So the applicant must be affiliated with an eligible institution. This means a nonprofit organization, a for-profit company, research or academic institution, limited liability companies, or any other legal institution that is incorporated in an eligible jurisdiction and is capable of receiving and administering funding. So what that means is that the organization needs to be set up as such that it can receive funding from Canada, so needs to be able to accept international funding transfers. There needs to be at least some basic financial policies in place. There needs to be either on the team itself or as a consultant of financial, someone that can manage the finances and has the proper training to do so. And then in terms of incorporation in an eligible jurisdiction, so that sort of the definition of incorporation changes between countries, and so GCC can't provide, a full clarity and confirmed definition for that in each of the jurisdictions that we could fund. So we, suggest that if you're uncertain about this, that you look, that the organization that's keen to apply does some of their own research to ensure that they are properly incorporated in their country. I should clarify, we've often had, questions and challenges when it comes to international NGOs. So for example, an international NGO with a headquarters in the US, but a country office, say in Nigeria, if that country office is itself incorporated in Nigeria, that's fine, that country office can apply. If they are simply permitted to operate in Nigeria, that is insufficient. And so the body that would need to apply would be the US entity, but the US entity would not be eligible under this call for funding. So again, we just suggest that you take a look at Appendix A of the RFP to get that clarity. If there are still questions, those are not really questions that we can address on this call. And so we would just suggest that if you have questions about the eligibility of your entity and its incorporation status, we'll do our best to address those questions if you send us an email to the stars at grandchallengescanada.ca email account. In terms of applications must include all required information and address all questions. Only complete applications will be considered for review, and these applications must be submitted, not just saved, but submitted on the Flux online portal. I point out this distinction between saved and submitted because it's essentially a two-step process. When you go in to edit your application form, you'll need to save it, but then to actually push it through for submission, there's a second button that you need to press that's called submit. So just make sure you are indeed hitting that submit button. And then just to clarify, applications must be submitted in either English or French. Unfortunately, we don't have the capacity to review applications in any other languages at this time at Grand Challenges. And then finally, a majority of the applicant's activities and budget must be carried out in Sub-Saharan Africa. So again, that just aligns with our implementation and testing requirements. So implementation and testing, and hence activities and budget must be spent for the large part in Sub-Saharan Africa. Now let's talk about some important dates. So as you may know, we have pushed and extended our deadline to register for a Flex account to May 31st, 2021 at 2 p.m. Eastern. The deadline for submission, very important date here, is June 3rd. And then once applications are submitted and the review process is complete, we expect to notify all applicants of their approval or rejection by no later than October of 2021. Selected and successful applicants will then go through a negotiation process that will cover, the intention is to split the selected innovations into sort of 2 cohorts. The first cohort will be negotiated between October and December of 2021 with a start date in about January. And then the second cohort will negotiate between January and March of 2022 with a start date around April. I mentioned the Flux registration. Given that we are very cognizant the Flux portal can be a little intimidating if it's your first time using it, we just wanted to quickly go over some of the details that you'll see. So an important note is that if you have an existing Flux account, you do not need to re-register. You can use that existing account. If you have lost or forgotten your password, you can just click the reset password button right here. And our tech team will send you your login information, so no problems about that. If you are new to the GCC world and you've not yet gone through the Flux process, you'll need to create an account. So again, the registration deadline is May 31st. We encourage you to do this sooner if possible, so that you don't run into any tech issues or delays that could impact your application. So if you do need to create a new account, you'll be clicking here, create password, or here, create a new account. You'll be brought to this page where there's a form that you'll need to complete, a number of fields, and then it will take where the estimate is up to 3 business days to receive your login details. So make sure you give yourself enough time. I just wanted to highlight that the person creating an account will be the individual that's associated with that application. And so it should be the project lead. If the project lead themselves is not completing this and has nominated another individual, we encourage that the project lead provide the relevant information so that their information can be inputted into this application form, including the account registration. Once you get your account information, you'll log in and then you'll come to this page, the welcome page. On the welcome page, you'll have the option then to start a new start request. And that's where you'll click on to access the application, just clarifying that you can come back to the application many times. You just save your edits. And then, as I mentioned, you have a second step to actually submit it. So you can work on it in a few different time spots if needed, and involve different team members if that's relevant to you as well. So we encourage everyone to visit the Grand Challenges website, specifically the Stars in Global Health page. On that web page, you'll find in both English and French the following key documents: the request for proposals, the frequently asked questions, a 2-pager overview, the application questions themselves, and the Flux Quick Reference Guide, which will cover everything I just talked about. So moving on to the screening and review process. So applications that are deemed eligible will move forward to the innovation screen stage. And during this stage, only a subset of application questions, those marked in the application form with an asterisk, will be assessed by Grand Challenges Canada staff and a group of external advisors and reviewers based on the criteria of relevance and innovation. Only the selected questions, those marked with an asterisk, will be read at this stage. So do ensure that these questions are adequately addressed. Okay, moving on. After the innovation screen, applications that are deemed relevant and innovative will move forward to the external peer review stage. And at this stage, an independent expert peer review panel of external scientific, social, and business experts, including innovators past and present, will review the full application using the criteria of impact, innovation, project execution plan, leadership capability, and value for effort. So the reviewers will be provided with a subset of criteria under each category, which align very closely with the questions in the application form. And then they will provide a scored review. Each application will be reviewed by 3 reviewers and the average score taken. I should also mention at the innovation screen process, it is the same thing. Every application is reviewed by 3 reviewers and then the average score is taken. Okay, moving on to application tips. So we just wanted to flag that applicants should be mindful of the character limits on each of the questions. So if you are working, say, with a team offline to address the questions, just be mindful when you copy things in that you're within the character limits, so you don't have any last minute scurrying to reduce the questions and perhaps missing some important information that you wanted to convey. Because of these character limits, we suggest that you only be highly descriptive when it's absolutely necessary to convey a key message. Otherwise, concise answers are best. We suggest that you respond in narrative format rather than in bullet points. And a reminder to please address all parts of each question. Read the questions carefully. Some questions have multiple components, and it's important that all sections be completed and addressed to successfully move through the process. And please be sure, again, to just take note of the questions with the asterisks. These questions only will be reviewed at the innovation screen stage. They will also be reviewed in the external review, but only that subset is reviewed at the innovation screen stage. So yeah, just pay particular attention when completing those questions. We just also wanted to touch on things, that we will not fund in this round of the STARS in Global Health RFP. So projects involving establishing proof of concept of innovations for which the core intellectual property rights are owned by a third-party institution will not be funded unless that third party grants the applicant sufficient license rights to the innovation to permit eventual scaling in low and middle income countries, or signs an undertaking to comply with our global access policy. We will not fund projects similar to ones Grand Challenges Canada has already funded. That speaks to the innovativeness of a project. So we suggest that you review our searchable database of funded innovations for more information on previously funded projects, if that is a concern to you. We will not fund projects implementing in countries that are not listed in Appendix A. So again, please review Appendix A. I've mentioned it several times now, so I hope it's obvious that this is quite an important section of the RFP. It outlines who can apply and where they can implement to be eligible for this funding. And then finally, we will not be funding projects that are focused strictly on capacity building and/or advocacy and do not involve the testing of an innovative proof of concept. So I mentioned GCC's searchable database. We are aware it is not always the most straightforward site to navigate, so we just wanted to provide some clarification. If you go to the main Grand Challenges Canada webpage, and then you look up on this top menu bar here, you'll see Learn What We Do. If you select that option and then into the drop down, go to Innovations and Results, that will bring you to this page with the map. And then you can use a variety of filters to kind of find past innovations that might align. So again, just highlighting the need for innovative ideas to come through in this RFP. So thank you for your attention. We now have a full 30 minutes for our open Q&A period. Again, before we jump into that, I just wanted to give a reminder, I'm sorry, that the application deadline is June 3rd of 2021 at 2 p.m. Eastern. And applications must be submitted via the Flux portal. For the first time ever, STARS has made the application questions available on our website outside of Flux. We've done that at the request of past innovator cohorts. So we are doing that as a way to hopefully just provide folks with more information before they go ahead and start their applications. But even though those questions are available on our website, applicants must submit through the Flux portal. Again, if your questions are not addressed during the rest of this session, or you have really, very specific questions that we might need to discuss or get a little bit more information on, please feel free to reach out to our email account, stars@grandchallenges.ca, listed here on the screen. That is monitored daily. In fact, I believe Lori's checking it 2 to 3 times a day lately. So you should get a response within a day or so. We are keen to ensure you can move ahead with your application and have all your questions addressed as soon as possible. With that being said, I would love to open it up for questions. I am going to stop sharing my screen so I can see what's coming across here. And again, just thank you for everyone's attention. We're thrilled that you could join us, and we hope this was helpful. Okay, so I see a question here. Is it a requirement that the applying entity prove having handled funds equal to the seed grant? No. So we are very keen at Grand Challenges Canada to fund, smaller, younger, newer entities and organizations, so long as you have the ability to receive and manage the funds. We, during the negotiation process, selected projects will go through a due diligence process, including a due diligence by our finance and legal teams. Teams are then, institution is then given an institutional risk rating according to GCC's internal matrices. The risk rating is an internal thing. And, a higher risk entity, so potentially a younger institution that's managed only a few $1,000s of funding, say, would just need to report on a more frequent basis, and that frequency would be about quarterly, as opposed to a more established, less risky institution that might have to report only semi-annually. I hope that was helpful. How does GCC define innovation? That is a fabulous question. I would encourage you to review our website, which has our formal definition of integrated innovation. At GCC, that's really how we view innovation, is, encompassing business, social, and scientific innovation to really meet the most salient needs. When we're talking about, the need to be innovative in your application, that can mean that this is an entirely new and novel idea and intervention that, has a basis in the literature or on the ground, but has not yet been tested. Also, it could mean an intervention that has, demonstrated impact in one context. So say in an urban slum, but has never been tested in a rural or remote area. And if you're proposing to do that test and to establish proof of concept in that new context, so in the rural or remote area, that would, qualify as an innovative, proof of concept. So that would also qualify. I hope that sheds some light. Feel free to add any follow-up questions. Dr. Matangwa, I see I think part of your question was already addressed, but you're referring to a work plan, a KPIs, that sort of thing. If I'm understanding correctly, you're wondering if those components can be attached to the application. And right. So if that's okay, perfect. So no, we do not ask that those pieces be submitted at the time of application. Rather, we ask that you try to address as much as possible the key components of those various documents within the application questions. And then if your team is successful in moving through the various review processes and is selected for an award, it's at the negotiation period that we would work with you and dive into that level of detail. So essentially, we're just trying to limit the burden on applicants at this early application stage, and then dig into the very kind of nitty-gritty detailed work of the program at the negotiation stage before contracting.
Thank you.
No problem. Okay, considering the lack of reliable and cost-effective power supply is an impediment to quality healthcare services in Sub-Saharan Africa, I'd like to know if innovative clean energy solution for healthcare providers could be eligible for consideration under the STARS and Global Health program. So unless you have an idea for quite an interesting spin on that, I would say it's unlikely that that a clean energy innovation would meet the eligibility criteria for this call. I'm just looking back on my slide deck here. I would turn your attention to section 2.1 of the RFP document, which again outlines the areas of focus, as well as the priority outcomes that must be addressed, through your project. So unless in some way a clean energy project can demonstrate impact on things like contraception care and education, sexual gender-based violence, female genital mutilation, child early forced marriage, it would not fit this call. Although I would suggest that you look out for future calls. I'm not sure of the context in which you are implementing, but I know that our humanitarian Grand Challenge team has a WASH area of focus, water, hygiene, and sanitation. So that might be a better fit for your innovation. Okay, I see a question coming up. Is there a possibility of renewal of funding after completing the first 12 months? Some outcomes may need to be measured after a much longer period. So the time period for STARS and Global Health, is a challenge. This is a proof of concept funding program. So the idea is to be able to spread our funding most widely, hence the limited $100,000 on the 12-month period. GCC generally exclusively funds proof of concepts a single time. So we would not fund a second round of proof of concept for the same innovation. If you are able to establish some, early indicators, but have goals to continue monitoring for, medium and longer term indicators, that's totally acceptable. We would just need to work out what is possible for you to establish within that initial period. So that's what we would be holding you accountable to. And it would need to, align with the priority outcomes that I described and that are listed in section 2.1 of the RFP. But we absolutely welcome teams continuing the work that GCC may have initially funded, and following up with us and sharing what their medium and long-term results are, even if it's after the GCC period. Because the more and the stronger the results that you can share with us, the greater the likelihood that we would be considering a potential transition to scale investment. So that actually brings me to another point that I might just share. No one asked, but I'll share it anyways, because it's something we get questions on quite frequently. But not all innovations that are funded at the proof of concept stage will receive transition to scale funding. We are funding 60 to 70 innovations at proof of concept in this round alone, and don't hold me to these numbers, but that is kind of almost equivalent to the number of active transition to scale projects in our current portfolio. So there's no way we can possibly fund everything. Also, some of the proof of concept projects we know are not going to establish proof of concept, and that's okay. The learning is still really vitally important to the space. And so, only the most promising innovations will be floated up to transition to scale for consideration. And so if you follow up with, results from down the line, that could increase your likelihood of being considered at a later date for transition to scale. I hope that adequately addresses the question, and please follow up if there's still some, if there's still a lack of clarity there.
Yeah, thank you very much, Manzan.
Okay, perfect, thank you. Okay, I see another question here. If selected, who goes into the first cohort and who goes into the second cohort? We've not quite established that yet, but given that we have some flexibility, if a team has a strong preference for one or the other, we can do our best to try to accommodate that. And so we'll discuss that, on a case-by-case basis with the selected teams.
Okay, thank you very much for that.
No problem. Okay, I see another question here. We are a digital tech provider that is partnering with an organization providing gender-based violence services. Since we are the main applicant, how best can we demonstrate that the innovation is designed with and for people experiencing gender-based violence? So I would suggest that you work with the, organization on the ground, working with the people experiencing gender-based violence, to provide a comprehensive picture of what the intervention is going to be. So it sounds like the intervention is in part the tech that you're providing, but in part how that tech is being delivered or shared or provided to the folks in need of it. So the application should be a picture of that full program.
Yeah, thanks for that. So it's always been a bit challenging to get these applications, how much involvement and writing gets done by partners. So we're always at a disadvantage when we need some of this information to come from the partner. And that's been one of the challenges. But is it possible to say that a part of this will be done as we go along, because we do have technologies that have demonstrated effectiveness in related areas, and the partner has demonstrated experience with serving gender-based violence and its needs, and some of the more the fine-tuning and design will happen as part of this project?
So Yes. So GCC is a strong proponent of iteration as these projects advance. So refining the plan, refining the design, pivots if necessary, as long as those are, raised to Grand Challenges Canada and don't differ too significantly from the original application. It's fine that that happens throughout the project period. What I would just caution is that it's important that the application provide a sufficient picture of what the intention of the project is, including the component that will be, in the hands of your partner, so that reviewers have a sufficient idea of what your project execution plan will be, because you might remember that one of the review criteria, one of the review categories is the project execution plan. So long as you're providing a sufficient idea of what the project, how the project will be implemented in the field, how your tech will be deployed in the field, even if that needs to be open for some modification as things move forward, then you should be okay.
Thank you.
No problem. Okay. There's a question here. We are providing SGBV services, but are partnering with a tech company to provide the technology we require. Is this permitted? Absolutely. Partnerships are wonderful, and some of our most impactful innovations in the GCC portfolio involve really strong partnerships. What I would say is this comes, a partnership, particularly where technology is involved, is where sometimes we encounter these IP issues. And so I would just ensure that your partner has clarity on what their obligations would be under GCC funding. And so I would suggest that you encourage the partner to review the RFP, to take a look at Grand Challenges global access and data access policies. Those are the most important and relevant to IP. And so long as you have a strong partnership with that provider, they're on board for meeting GCC's policies and requirements, then there shouldn't be a problem there. Please keep the questions coming. These are great questions, everyone. So I know this question has been answered in the chat already, but I just wanted to kind of vocalize it here. When is the last day for receiving inquiries via email? You're welcome to send us emails up until the day of submission. I would just suggest that we are a limited team. We have only so many resources. So I would just suggest that you send those questions through as early as possible, and we will make every effort to answer questions up until the submission deadline. Again, just be sure that you meet our registration deadline on Flux to register for a Flux account by May 31st, and then the submission deadline is June 3rd. If anyone has a question that they've not put in the chat or that has not yet been answered and that they want to just ask live here, please just use the raise your hand function, and our tech guru Lori will will unmute you so you can raise the question. This recording will be up on YouTube. Maybe not today. Hopefully by tomorrow. We'll try to get it up as soon as possible. Sometimes these recordings take a while to download and then upload again, but as soon as possible. And they'll be linked on our website as well, so it'll be easy access. All right, we've still got 9 minutes left, so please feel free to pop in with any additional questions. If you're feeling comfortable and confident moving forward into your application, feel free to drop off. But we'll be here still for another 10 minutes. Ooh, what are the past recipients up to? That's a great question. And it really varies. You know, some teams keep in contact, others we haven't heard from in quite some time. Obviously, over 10 years, I mentioned 752, I believe, innovations. That's quite a cohort. And so, you know, some of them are in contact with one another. Some of them are still in contact with us. Many have carried on the work that was originally funded at STARS. Some have moved on to be funded at Transition to Scale through Grand Challenges Canada. Others have been connected to other funding partners and have been transitioning to scale through others. We have some that have been taken up by local, regional, provincial, national governments, you know, if you're a public path to scale. So there's really a great diversity in how things have moved forward for these various innovators. I would just say one of the pieces of feedback that we have heard pretty consistently is about sort of networking and connection amongst our cohort of innovators. And at STARS, given the volume of projects in each round, so as I mentioned, 60 to 70 projects, and we're only a team of 3 here at GCC, so it's quite a volume, and therefore we're a little bit limited in what we can do. But we're starting to think of really some interesting ideas that have been implemented in other programs here at GCC that have worked really well. In terms of, you know, technical group-based support that can be provided throughout the project period, that can also serve as a connection point for our innovators, so that it's more of a community and not just a bunch of people getting funded separately. We really want to create that community. We've seen that been tremendously effective amongst other portfolios at GCC. You know, on our Saving Brains portfolio, the early childhood development focused portfolio, there were even 2 proof of concept teams that sort of joined forces and were then funded at Transition to Scale for a hybrid innovation. And so, you know, that's the type of collaboration and camaraderie that we want to see in all of our portfolios, and something that we're really working hard towards here at STARS. A great question. Is there a full proposal required apart from Flux portal application? Swat answered this on the chat, but I'll just reiterate. The only application that is required at this stage is to answer the questions on the Flux application form. As long as those are submitted, your application will be reviewed and considered. Again, just a reminder, if you have any additional questions that weren't answered during our conversation today, or you have very specific questions that you need a little bit more background or context, please just send us an email at stars@grandchallengescanada.ca, and we'll do our best to answer as quickly as possible. La session française se tiendra demain matin à 9 heures. Wonderful. Thank you, everyone, for your participation. We're so grateful to have you all join us today. And thanks for your great questions.
Thank you very much as well. Bye-bye.
Bye-bye.
Thank you and bye-bye.
Thank you.
Thank you.
Thank you. Goodbye.